Hi, my name is Henry. I am a fourth grader at E.W. Luther Elementary School. My favorite subject in school is writing, and you are listening to the SM Way podcast.
Thank you, Henry. I'm Daniel Bader, Communication Coordinator for the School District of South Milwaukee. I went over to Luther to meet Henry for a little intro. If you've never been in the school, there's a lightness to the air. I popped into 2 classrooms and saw smiling kids and energetic and engaged teachers. And I'm not just saying that. You can kind of tell when a school isn't happy, but Luther sure is, and it's more than just the holiday spirit. Today we're spotlighting a staff member, District Nurse Stephanie Cahlamer. Cahlamer is new to the district. She started roughly when I did in February. She's part of the Special Education and People Services Department in South Milwaukee, a remarkable team that's integrating what they do with what our teachers do. Our moral imperative at South Milwaukee is to act with a relentless commitment to remove barriers and to care for all students so they feel accepted and will learn without exception. That's not just a catchphrase or some corporate mission statement. It's what the teachers and staff here aspire to. Stephanie and her team are an important part of how we fulfill that imperative because she and her team and everyone in People Services works with students who have medical or other needs to make sure they're not barriers to their education. I could speak with anyone from that department for this episode, but I joke that Stephanie is our resident superhero, and I bet you'll agree with me when you meet her and hear her background. Here's Stephanie. Stephanie Cahlamer, welcome to the podcast.
Hi, thanks for having me.
So, normally when I have a staff member on, I ask about their big why they chose to go into schools. I want to ask you why you chose to go into nursing. What's your big why? And then tell me why you came to South Milwaukee.
Well, I wanted to be a nurse as long as I can remember. I started as a CNA in high school, and I just really like being able to help people, make a difference, and it makes a difference in my own world as well. So I started off with emergency care and a lot of critical care nursing and emergency nursing. And within that world, I saw a lot of the kids who are in schools and not quite needing emergency care or critical care. They were being missed. They were falling through the holes, falling through the cracks. And school nursing not only allows me to have a schedule for my own family, but also allows me to make a difference in a place where it's being missed sometimes.
So before we talk about what you do here, you have an impressive list of credentials.
Thank you.
Can you tell me a little bit about them or tell our listeners what they are?
Yeah, so I am critical care certified. I've been in the ICU for 10 years. I'm still currently employed there just part-time at Children's Hospital in our cardiac ICU. So I have a critical care certification for that. I'm also an EMT and firefighter, and I've done volunteer firefighting previously. I worked for a helicopter rescue service for a short time, and then now I'm doing the school nursing thing. So just all the certifications that go along with that.
Wow. How much, I mean, we have a certified nursing program here, at least where kids get close or they're nursing assistants.
Yep. Mm-hmm.
What kind of education does it take? How long were you in school for all that?
Well, I got my CNA in high school, like is available here at South Milwaukee. So that's a semester-long class. Sometimes it's 2 semesters, depends how they break it up. So that started when I was 16, and then I did a slew of classes throughout technical school, and then did my bachelor's at UWM, and that took another 4 years. So total, I guess, 6 years or so, and then after that, it's continuous classes, just continuing ed and things.
Yeah, it sounds kind of the equivalent of a bachelor's and a master's degree, but just in the medical world.
Yeah. Mm-hmm. Mm-hmm. Yes. Mm-hmm.
And then, man, some of those. So, how do you become a firefighter too? Like on top of that?
I started as an EMT because I like the emergency world. And while I was working for the fire department, I just got to see a whole nother world on the fire side. And we would do helping them after fires and recouping them. And I just wanted to be part of that as well and just kind of get the whole picture.
Are you part of a volunteer squad now or a squad anywhere?
I'm in between right now. And yeah, so that I was there for about 6 years. And just with timing and with a few jobs that I'm doing right now, I'm taking a break from that.
Sure.
So,
Gosh, you must know how to deal with acute stress or, I guess, adrenaline in your jobs. All of them sound like they're very intense.
Yeah. Yes, it does. It teaches you how to stay calm in a lot of different situations. So we don't get a lot of super high stressful situations here at school, but it definitely helps to have the broad knowledge to know, where all my resources are when I need them. And it just helps you to have a clear mind when things do go awry, that you can think clearly.
And I guess all the procedures for when an ambulance comes, if one has to, or how to talk to a firefighter or a police officer if they're in the building. Yeah, that's a major advantage for us, I think.
Yeah, it is. It's definitely nice to know. There's certain things I can do as a nurse, and then other things that I could have done under my EMT license. I'm still licensed as an EMT, but being that I'm here in a different situation, you have to work underneath your scope. So we only have certain resources here, but knowing when it's important to call an ambulance versus when parents can take, to the hospital, or do we even need 911? Are they going to be able to do anything for this child that we can't do here, or that they can only do at the hospital? So
Sure. And then I'm interested in the flight nurse part. How did you get into that, and what is it like?
Yeah, it was a goal of mine forever. So I just kind of took the steps that I needed to get there. And it's great. The people that work there are fantastic and know exactly what needs to be done. And, you talk about staying very calm under stress, and that's something they can definitely do. It's very exciting, and it's a good role to have.
Yeah. So I guess my perception of that is when there's an immediate need and an ambulance isn't fast enough, you get on a helicopter with someone like you and get to the hospital. Is that what it is?
Yeah. It's sometimes ambulances can't get through fast enough because whether it be where they are out in the country or traffic at that time, things like that. There's also the ambulance in the air can deal with the higher acuity patients sometimes, depending on what kind of an ambulance service is available and around at that time. A lot of times patients need blood to be given, and that's something, that sometimes an ambulance service cannot do. Certain rescue medications can only be given by that level provider.
Does that happen a lot? Have you had to fly a lot?
I think they're busy. Yeah, they're busy often. Yes. Yeah. Mm-hmm.
Wow. I guess you're not afraid of heights.
I'm not, no.
So let's talk about your role here at South Milwaukee. Now, you're the district nurse. What does that mean?
So I span all 6 schools. I also work with the community and our fire departments and things to come up with policies and protocols to span through our schools, and work with our medical director to write our policies for the year. I have a team underneath me that we work very closely to staff the health rooms and make sure all the kids are safe within the schools. That includes doing scheduled medications or emergencies or just, belly aches throughout the day. It also includes teaching staff and teachers our policies and emergency procedures. We're in the midst of, working on different things that, we'll be teaching them as in regards to CPR or Narcan administration, things like that, where everybody kind of becomes part of the emergency team instead of just, the 7 healthcare team members that we have.
Interesting. Can you give me an example?
Of what we're teaching?
Yeah.
So one thing that we're working on that we are still in the midst of is, one of my big goals is to become Project Adam certified or acclimated. So we Project Adam goes through Children's Hospital, and Adam was a 17-year-old who passed away during a basketball game. Most likely could have been saved with an AED and an emergency plan in place. So parents have really pushed this teaching and has now become Project Adam. I'm a part of the Project Adam program over at Children's Hospital, and so try to help school districts learn how to respond in a cardiac emergency, make sure that our AEDs are all up to date, with everything all the pads and batteries and everything being up to date and in places that people know where they are and they can access them and they're working. And then teaching the staff how to do CPR, when to know what to do, and then all the different roles that occurred during that emergency. There's another district that I went through this with, Germantown School District, and at first it's very scary for staff and teachers because they're not medical, and it's scary. But once you know it and have been through it and practice it, it's just so great to know, and they're so thankful that they have that information.
And where are you at in Project Adam?
So right now we're working on CPR teaching and AED maintenance. So we just revamped all of our AEDs and making sure that they're all up to date. And then working with another staff member to get everybody, not everybody, but as many people as we can, CPR trained, whether that be a hands-only CPR or a CPR certification. So we're in the midst of booking, staff members that are really anxious and people really would like to be trained. So it's really great to see the enthusiasm for this program.
What does a modern school nursing program look like?
Yeah, I think it has really evolved over the years, especially now through COVID. I think that we're responsible for a lot of things that span a lot of ways. So we deal with just the general sick kids at school, first of all, and the kids that come in and just have a bellyache or a headache and things like that. We also have some pretty acute students that are able to attend school because we're able to have a health plan in place for them. So we work closely with their doctors and the nurses and health aides here to, and with the parents to develop a plan that will keep them safe and healthy while they're in school and while they're under our care, and that, can span from just regular medications to G-tube feeding to suctioning, things like that a lot of times, used to only be able to happen at home.
Sure. So, wow.
Mm-hmm.
And I know that you've done a lot of outreach with teachers to try to make everyone who should be aware of a student's medical needs aware of them. Right.
The teachers are such, a big part of this plan because they're with the students all day, so the health team is around and available, but the teachers really play a big role, and they're an important part of it.
Mm-hmm.
Mm-hmm.
So when a student's not feeling well in a class and they go down to school nurse, they're
mm-hmm.
not seeing you, right? They're seeing one of your team members.
Yeah, usually one of my team members. I make it around to all the rooms, try to daily, or if we have a sick call, then I staff a room. But yeah, it's mostly the health aides. And then we have another nurse that staffs the high school and the middle school. So they see a lot of kids every day. Last year, I think it was close to 25,000 visits. So
wow.
This year, I think we're already at about 11,000 visits. So they're busy. They're busy all day. And so I try to help staff and help staff our busier rooms when I can. But yeah, they do a fantastic job.
Sure. And blood sugar management is a really big part of your day, isn't it?
Yeah. We have quite a few diabetic students, and we work really closely with the student and the parents, and as well as the doctor to help do teaching with them. So not only are we managing their sugars and helping them with their insulin, but helping to teach them to be independent with their disease. And it's just an important part of life, knowing, to deal with it and deal with all the everything that goes along with having that disease.
Sure, because type 1 diabetes can kind of become apparent at school age, right? I mean, mm-hmm. that's when it happens.
Yes.
So.
Mm-hmm. Yeah, it is. It is when it comes about. And a lot of times it takes a huge team to be able to make it work while they're at school. And it's a scary thing for parents to have 100% of the control while they're at home and know they're okay, and to give us their trust and know that we're going to keep their kids safe while they're here for 8 hours a day, which is a hard thing. So.
Yeah, and all the monitoring equipment. My son's best friend is type 1 diabetic, and his mom has an app that she can monitor his sugar. So you must mm-hmm. also have a lot of interactions with parents when there might be a blood sugar problem.
Yes. Yeah, parents are a big part of the plan as well, and they know their kids' the best. So it's working with them, asking questions when we need to, and just kind of working together to make sure that we are all on the same page in dealing with whatever's going on.
Sure. So the other thing that we've interacted with is kind of over-the-counter medication for students. What is like aspirin? Or are we talking about cold medicine? What is it?
Yeah, we have a few options that our medical director has approved, and with the approval of the medical director, we also have to have approval from parents. So it's Tylenol, ibuprofen, an allergy medication, and then we also have just some topical ointments for itching and for injuries, things like that. Cough drops are something too that takes a parent signature to make sure that's okay that we give that to them. We also have not that it's over the counter, but EpiPens for a lot of students and inhalers for a lot of students, and those all go through the doctor's orders and then come to us as well.
That's a lot of record keeping.
It is,
Yeah.
yes. Mm-hmm, yeah.
So we're in the middle. You mentioned cough drops, and that got me thinking. We're in the middle of cold and virus season. We just sent a communication out last week about what to do, but I was wondering if you could talk a little bit about that. When should a parent keep their student home, and when is it okay to send them in? And what happens if they get sick at school?
Yeah, so some of our hard and fast rules are a fever of 100.0 and over. That requires them to stay home, and that's a 24-hour at-home hold. It's just a cue that the body is working on something bigger when it gets to be up that high. Every once in a while, our body's kind of trying to fight something a little virus that's not going to be, affecting us as much or not as contagious, and it will usually stay under that 100 degree cold or fever. So it's important if a child has 100-degree fever that they stay home. If they're at school and they come in, they're not feeling well, or they're found to have a fever, then that's when they will be sent home at that 100. There's times when we will request they go home under that, and that's, it's the whole person that's sick. So if we're seeing that they're very fatigued, they have, they're really not feeling well, then they go home as well. Some other ways that they should be staying home is thick drainage, colored thick drainage. Any vomiting is a stay home or send home. And then diarrhea more than twice is something that either they need to stay home or are sent home.
Sure. Yeah, I can imagine that's uncomfortable just to be anywhere. If you need to get home, you need to get home. Right.
Yeah. And, it's for their comfort too, as well as the safety and health of the staff, as well as the other students that are in the classroom. There's things too that people often have questions about, like pink eye, chicken pox, things like that. And so with pink eye, when there's a lot of drainage, that's a stay home and go to the doctor. So those drops are 24-hour drops once they're on antibiotics, or drops for 24 hours. They can come back. And then chicken pox is after everything is healed up and scabbed over and nothing is open. That's when they can come back.
Oh, wow. Yeah. And I imagine a lot of people feel this way coming off of our COVID years. Every time my kid said he was a little bit sick or had a little bit of a sniffle, I kept him at the beginning in September. We're way past that now.
Right.
Because we've been hit with everything. But when is it okay, even if they look like they're fighting a little something, to go to school?
Yeah, if they're able to participate in class and they are able to remain healthy and safe around the other students, they don't have a fever, there's no vomiting, there's no diarrhea, there's colds, and we all have colds, multiple colds throughout the year, and we don't want to keep them home for everything either, and we want them to be able to stay in school and continue learning, because it's really hard for kids to catch up, and missing all those days of school just isn't good either. So it's a fine line, but parents know their kids the best, and teachers are not far behind because they're with them so often. So just working together, knowing, when we see them at school and they're really just not feeling well throughout the day as they're getting worse, then it'll be a call to home.
Should you at least give it a shot? Because that's what we've been doing lately, is if they have trouble getting up, but they don't have those, indicators you mentioned. Just get to school, and if you feel worse, I'll come get you.
Yeah, it is. It's worth giving it a shot when there's not those hard and fast things where they should not come for sure. It's a decision maker at home. It's just you have to make the decision. But definitely there's a time to come to school, even when there's a little sniffle.
Yeah.
So,
How about the other end? I mean, we've fought so hard to get healthy in our household that we're a little germophobic going to school.
Mm-hmm.
What are some preventive measures that you recommend, and what are you seeing families doing in school?
Mm-hmm. Everybody always has the option of wearing a mask. We have many masks throughout the school, boxes of them everywhere that anybody can have one at any time. We also have a lot of extra hand sanitizer. Washing hands that's the number one preventer of any illness. So just making sure that the whole family does wash hands, encouraging kids to wash hands, and wearing masks, is always an option. Some extra things that we're doing at the school is when we have more than 5 kids that are out in a class, just to kind of be sure that we're being thorough. We do temperature checks on the whole class, and anybody that's over 100 will be sent home. We're also, our cleaning staff will be doing some extra cleaning with some communication after school that they'll clean extra after school in those classrooms.
Mm-hmm. And our because COVID is still with us, it's 5 days out and then 5 days back with the mask. Right?
Yep. Yes. If the child is COVID positive, the 5 days starts at the beginning of symptoms, and then 5 days after that. So 10 days with a mask from the start of symptoms. Yeah. If a student is in a household with a positive person, but they are not positive, it's 10 days with the mask from the start of that person's.
Got it. Okay. Yeah, that's part I hadn't considered.
Mm-hmm.
And then those 5 days count the weekend. So if it starts
Yes.
on a Wednesday, your 5 days is over by Monday.
Correct.
Pretty much,
Yeah.
right?
Mm-hmm.
Anything else that parents should know about school this year that you want to tell them?
Yeah, I think everybody just keep doing what they're doing, because everybody's doing a good job and working as a team, and just remembering that we have a whole district of kids that we're working on, and trying to keep healthy and safe, and just working as a team is very important.
Sure.
So.
One thing that a principal has reminded me that if you get an excuse from a doctor, if you've gone to see at an urgent care or at a minute clinic or wherever, that doesn't count against your student at all when it comes to attendance.
Correct.
Yeah.
Mm-hmm.
Wisconsin is, you pretty much get 10 days before you start hearing from the school throughout the whole year. And that's a lot of days. That's because we're only in 174 days. And you spread that out, and we're missing work. So I guess just remember, count those days and try to get your doctor's notes.
Mm-hmm. Yep. Yeah, it's important for sure.
Okay. Well, Stephanie Cahlamer, thank you so much for coming on the podcast. It's been great. Thanks for being part of the district.
Thanks for having me.
Again, a big thank you to Stephanie Cahlamer and her team for caring so much for our kids, and to the Special Education and Pupil Services Department for knocking down barriers to learning. If you have a topic you'd like to hear on the SMY podcast, send us an email at info@sdsm.k12.wy.us. You can find this podcast on iTunes, Spotify, and pretty much everywhere you can find podcasts. This episode was produced by the School District of South Milwaukee. Thank you to the High School Music Department for their support in making this podcast happen. You can find more information about our schools at www.sdsm.k12.wy.us. Find us on Facebook, Instagram, and Twitter by searching the hashtag SMWay, or find us with the @ SOMILW schools. Have a great week.